Hello, I'm Professor Anthony Kessel and I'm the Responsible Officer for Medical Revalidation for Public Health England. In this podcast, I'm going to first introduce you to revalidation and my role as the Responsible Officer, and then hand you over to Imogen Stephens to talk you through the appraisal process. The podcast lasts less than 10 minutes and later on I'll tell you how to ask further questions. First of all, what is medical revalidation? Medical revalidation is a national process by which every licensed doctor will have to demonstrate to the General Medical Council that they are up to date and fit to practice. At Public Health England, this applies to all licensed medical doctors working as consultants and those in non-consultant roles. If you're a doctor holding registration with a license to practice, you will need to participate in revalidation. Revalidation will be based on evaluation of your performance against national standards approved by the General Medical Council over a period of 5 years. Every doctor in the UK has a so-called prescribed connection to a GMC, the General Medical Council, approved designated body for revalidation purposes. This is usually, but not always, your employer. So for those of you working for Public Health England, your designated body should be Public Health England. This is also the case for most public health clinical academics who will hold an honorary contract with Public Health England. If you're a doctor who is employed by a local authority, then your designated body is also Public Health England and I am your responsible officer. An important point to note though, which is why I had a caveat just earlier, is that any doctor who is currently active in general practice and on a performers list, no matter how many sessions this may entail, should revalidate through general practice. NHS England would be their designated body and their local area team medical director will be their responsible officer. It's your responsibility to check that your prescribed connection is correct. You can do this easily via the GMC revalidation website. All doctors will be expected to participate in a process of annual strengthened revalidation ready appraisals, supplemented by other supporting information such as around clinical governance and based on your whole practice. We'll come back to this later in the podcast. A recommendation of a doctor's fitness for revalidation will be based on 5 years' worth of these appraisals and will be made to the GMC by me as your responsible officer. I can make one of 3 recommendations to the GMC based on the information I have about you. First, I can make a positive recommendation that the doctor should be revalidated. A second option is I can make a recommendation to defer revalidation, usually to a maximum of 12 months, and the reasons for this must be discussed with me or my team first. Third, I can make a recommendation that the doctor has failed to engage in revalidation. This is a very serious matter and would be unlikely to come as a surprise to you. A positive revalidation recommendation from me will be followed shortly by a letter to you from the General Medical Council, which will inform you that your licence to practice has been renewed and giving you a new revalidation date in a further 5 years. Now I'm going to pass you over to the Deputy Responsible Officer, Dr Imogen Stephens, who will talk about the appraisal process.
Hello, my name is Imogen Stephens. I'm a consultant in public health and Deputy Responsible Officer. I work with Anthony and lead on implementing revalidation at Public Health England. Revalidation is quite straightforward, really. The cornerstone of revalidation is the annual Revalidation Ready appraisal. The first thing I would like to stress is that every annual professional appraisal should follow the same Revalidation Ready process and structure, whether your initial revalidation date is next month, next year or beyond. Secondly, your revalidation ready appraisal needs to cover the entire scope of your work as a licensed doctor. This may extend to more than one role, including voluntary activities if you need to be licensed in these roles. By the date of your revalidation submission, you should have demonstrated, through a cycle of annual professional appraisals, that you are continuing to meet all the principles and values set out in good medical practice. The cornerstone of every revalidation ready appraisal is the reflective appraisal interview with a trained appraiser. The appraiser must have undergone a top-up training programme with an accredited provider. This is why you can no longer simply arrange your own appraisal. Anthony, as responsible officer, needs to be assured that the appraisal interview conforms to certain standards and that the appraiser has been appropriately trained. Contact the revalidation team if you would like an annual appraisal arranged, and we will do our best to find you someone suitable. Every doctor should also have an annual line management appraisal, and certain key outputs of this are important inputs to the professional appraisal. These are your job plan, your agreed objectives, and your personal development plan. We have produced a diagram explaining what is needed for your revalidation ready appraisal. Some types of supporting information are normally only required once in each revalidation cycle, such as multi-source feedback and quality improvement activities, whilst others, relating to the remaining principles of good medical practice, should be provided each year. A top tip from me is to make sure that you have had a recent multi-source feedback involving colleagues relevant to the entire scope of your practice well in advance of your revalidation submission date. We have produced guidance on recommended colleague feedback tools. There are 6 key steps in making sure your appraisal and revalidation run smoothly. These are detailed in our 3rd revalidation briefing. The most important thing is to think appraisal and be well prepared. It's a very good idea to keep a folder on your computer for storing any useful pieces of work, especially unsolicited compliments, complaints, and any incidents or significant events that you have been involved in personally. Make sure you allow enough time to pull all the supporting information together in good time, and that you have made sufficiently detailed reflective notes on a range of these. To help you get to grips with the new system of appraisal and revalidation, we have developed a range of information resources for all doctors who will revalidate through Public Health England. These can be found at 2 locations. If your organisation has access to the PHE intranet, you can visit the Medical Revalidation page on PHEnet. Or, if you don't have access to the PHE intranet, you can simply visit our Revalidation in PHE page on the NHS Network's site, which can be found with a simple Google search. The revalidation team is also running phone-in revalidation teleconferences every Friday lunchtime, where you can interact with our knowledgeable team and pose any questions to them you would like. Details for these teleconferences are available from the revalidation team. More specific or unusual questions can be dealt with by booking a telephone call with one of the revalidation team. If there is a question you feel isn't adequately answered by the available resources, or if you are interested in learning more about the work of the Revalidation Steering Group, you can email revalidation@phe.gov.uk.
I'm pleased to report that with the help of a highly capable team and through the oversight of our Revalidation Steering Group, we've made significant progress in implementing this new system of medical revalidation within Public Health England and in relation to responsibilities for the public health system more broadly. We will continue to produce regular briefings to keep you updated and informed of aspects of the system as things develop further. Currently, we've produced briefings on multi-source feedback. We've also produced a briefing which is a step-by-step guide to annual professional appraisal. We've produced a guide to effective practice and reflective notes in the context of revalidation for doctors in public health and medical microbiology roles. And we've produced a briefing which is a discussion on quality improvement activities which you will need to show you partake in regularly. While it is clearly the responsibility of the revalidating doctor to ensure that they complete their annual appraisal in a timely manner, we are striving to make the process as straightforward and helpful as possible, and I do recommend you make use of all the available resources. Many thanks for your time.